The prescription sitting in your medicine cabinet right now may be the reason your blood sugar refuses to come down. Not the donuts, not the white bread, not the lack of exercise. The medication your doctor prescribed to control your diabetes could be silently feeding the very problem it was supposed to fix. And the terrifying part? Most physicians never mention this. They simply write the refill and send you home. Stay with me until the end, because the number one hidden trigger I'm going to reveal today is something that affects over 40 million Americans with type 2 diabetes, and yet it is almost never discussed in a 15-minute office visit. One study found that patients who made this single change saw their fasting glucose drop by over 90 points in just 8 weeks. 90 points. Without changing their medication, without a dramatic diet overhaul, just by understanding what was quietly working against them. I'm Dr. Michael Carter, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've worked with thousands of men and women over 60 who came to me frustrated, defeated, already doing everything their doctor told them to do, and still watching their numbers climb. What I'm about to share goes against the comfortable narrative that most clinics rely on. But I've seen it with my own eyes, patient after patient, and I refuse to stay silent any longer. If this is already making you think, go ahead and hit that like button right now. It helps more people over 60 find information they actually need. Now let's talk about what is really happening inside your body. Here is what most people with type 2 diabetes are never told. Managing blood sugar is not just about insulin. It is about a complex web of hormones, gut bacteria, inflammation pathways, and yes, the medications themselves. After 60, your body becomes significantly more sensitive to drug interactions and side effects. Your kidneys filter more slowly. Your liver processes compounds at a fraction of the speed it did at 40. Your gut microbiome, which plays a massive role in glucose regulation, becomes more fragile. This means a medication that worked reasonably well for a 55-year-old may begin working against a 68-year-old in ways that never show up on a standard lab panel. The medical community has known about many of these mechanisms for decades, yet the default response to rising blood sugar is almost always the same. Increase the dose, add another drug, write another refill. And here is what terrifies me most. Every additional medication adds a new layer of potential interference. And some of the most commonly prescribed drugs for diabetes, blood pressure, and cholesterol are directly linked to glucose dysregulation in older adults. This is not about blaming your doctor. Most physicians are overworked, under-resourced, and trained in a system that rewards prescribing over investigating. This is about you having the information to ask better questions, make more informed decisions, and take real control of your health. So today, I am going to walk you through 7 medications and medication-related patterns that may be silently worsening your blood sugar, ranked from least severe to most damaging. And I am going to tell you exactly what to discuss with your doctor, what alternatives exist, and what steps you can start taking immediately. Let's begin. Number 7. Statins. The cholesterol drugs almost everyone over 60 is taking. If your doctor has ever told you your cholesterol is too high, chances are you were handed a prescription for a statin. Atorvastatin, rosuvastatin, simvastatin. These drugs are among the most prescribed medications in the world, and for certain populations, particularly those with existing cardiovascular disease, the research supporting their use is genuine. But here is what the brochure does not say. Statins have been shown in multiple large-scale studies to increase the risk of developing type 2 diabetes by anywhere from 10 to 40%, depending on the dose and the individual. And for people who already have diabetes, statins can make blood sugar control significantly harder. A major analysis published in the Journal of the American Medical Association reviewed data from over 90,000 patients and found that statin use was associated with a meaningful increase in fasting glucose levels, particularly in older adults. The mechanism is not fully understood, but researchers believe statins interfere with insulin secretion from the pancreatic beta cells and reduce the sensitivity of muscle and liver cells to insulin. In simple terms, your cells become less willing to absorb glucose from the bloodstream. And when you are already fighting insulin resistance, adding a drug that increases it is like trying to drain a bathtub while someone is turning the faucet higher. This does not mean you should stop your statin tomorrow. For some people, the cardiovascular protection is worth the trade-off, and that is a conversation you must have with your doctor. But it does mean you should be asking, is my dose the lowest effective option? Have we checked my fasting glucose since starting this medication? Are there non-statin alternatives for my specific risk profile? Number 6. Corticosteroids. The inflammation fighters with a hidden cost. Prednisone, methylprednisolone, dexamethasone. These are powerful anti-inflammatory medications used to treat everything from arthritis flares to allergic reactions to respiratory conditions. They work remarkably well for what they are designed to do, but their effect on blood sugar is dramatic, rapid, and often completely unexpected for the patient. Corticosteroids work by triggering the liver to release large amounts of glucose into the bloodstream, a process called gluconeogenesis. At the same time, they block insulin's ability to move that glucose into your cells. The result is a sharp spike in blood sugar that can begin within hours of the first dose and persist for as long as you are taking the medication. For someone without diabetes, this is usually managed by the body. For someone with type 2 diabetes, it can send blood sugar into ranges that feel frightening. Research published in Frontiers in Aging found that older adults on short-term corticosteroid therapy experienced average blood glucose increases of 60 to 120 points above their baseline. And the effect is dose-dependent. The higher the dose, the more dramatic the spike. Here is the important thing to know. If your doctor prescribes a corticosteroid for any reason, even a short 5-day course, you need to be monitoring your blood sugar more frequently during that period. You may need a temporary adjustment in your diabetes medication, and your doctor should be aware you are diabetic before that prescription is written. Always. Number 5. Beta blockers. The heart medications that mask the warning signs. Beta blockers like metoprolol, atenolol, and carvedilol are commonly prescribed after heart attacks, for high blood pressure, and for certain heart rhythm problems. They save lives in the right situations, but they carry 2 specific risks that every diabetic patient needs to understand. First, beta blockers can raise blood sugar levels, particularly the older, non-selective versions. They interfere with the body's ability to regulate glucose by blocking certain hormonal signals in the liver and muscles. A study published in the Journal of Clinical Nutrition found that patients on non-selective beta blockers had fasting glucose levels that were on average 18 to 24 points higher than matched controls not taking the medication. Second, and this is the one that genuinely frightens me, beta blockers mask hypoglycemia. Hypoglycemia is dangerously low blood sugar. Normally, when your glucose drops too low, your body sends clear warning signals: shakiness, sweating, rapid heartbeat, anxiety. These symptoms tell you something is wrong and you need to eat something immediately. Beta blockers suppress those warning signals, particularly the heart-related ones, because they block the adrenaline response. This means you can be experiencing dangerously low blood sugar and have no idea until you are already in serious trouble. For seniors, this is particularly dangerous. A hypoglycemic episode without warning signs can lead to confusion, falls, loss of consciousness, and in severe cases, cardiac events. If you are on a beta blocker and a diabetes medication that can cause low blood sugar, such as insulin or sulfonylureas, This is a conversation you must have with your cardiologist and your primary care physician together. Before I continue, I want to hear from you. How many medications are you currently taking for diabetes, blood pressure, or cholesterol combined? If it is 3 or more, type 3 in the comments. If it is 5 or more, type 5. You will be surprised how many people reading this are in exactly the same situation. Number 4. Thiazide diuretics. The blood pressure pills that steal your minerals and spike your glucose. Hydrochlorothiazide, chlorthalidone. These are some of the oldest and most commonly prescribed blood pressure medications in the world. They work by making your kidneys excrete more sodium and water, which lowers blood volume and reduces blood pressure. Simple, effective, inexpensive. Doctors love them. But here is what happens downstream. Thiazide diuretics also cause your kidneys to excrete potassium and magnesium. And here is why that matters enormously for blood sugar. Magnesium is a critical cofactor in over 300 enzymatic reactions in the body, including insulin signaling. When your magnesium drops, your cells become less responsive to insulin. Your pancreas also becomes less efficient at secreting insulin in the first place. The result is a classic setup for worsening blood glucose control that has nothing to do with what you ate. Research published in the New England Journal of Medicine found that long-term thiazide use was associated with a 23% increased risk of developing type 2 diabetes in non-diabetic patients. For those already diabetic, the effect on glucose control can be substantial and often goes unrecognized because no one is monitoring magnesium levels regularly. I remember Patricia, a 71-year-old retired school teacher from Atlanta. She came to my office frustrated and confused. She had been carefully following her meal plan, walking 30 minutes every day, and taking her medications without fail. But her blood sugar had been climbing steadily for almost a year. Her A1C had gone from 7.2 to 8.4, despite no major lifestyle changes. When I reviewed her complete medication list, I found she had been on hydrochlorothiazide for blood pressure for about 18 months. Her magnesium level, which had never been tested, came back at the very bottom of the normal range, functionally deficient. I worked with her cardiologist to switch her to a different class of blood pressure medication and started her on a magnesium glycinate supplement. 3 months later, she came back for a follow-up. She told me, "Doctor, my numbers are finally moving in the right direction. My fasting sugar dropped almost 40 points. I wish someone had told me about this connection years ago." This was not magic. This was her body finally getting what it needed to do its job properly. If you are on a thiazide diuretic and your blood sugar control has been worsening without a clear explanation, ask your doctor to check your magnesium level. It is a simple blood test. It is often overlooked, and it can change everything. Number 3. Antipsychotics and certain antidepressants. The psychiatric medications with profound metabolic consequences. This category surprises people. Many seniors are prescribed antipsychotic medications not for psychiatric disorders, but for sleep, anxiety, agitation, or even nausea. Medications like quetiapine, olanzapine, and risperidone are increasingly prescribed off-label in older adults. And certain antidepressants, particularly the older tricyclic class and some of the newer atypical ones, can have significant metabolic effects. The mechanism here is multifaceted. These medications affect dopamine and serotonin pathways that are directly involved in appetite regulation, fat storage, and insulin sensitivity. Some of them cause significant weight gain, which independently worsens insulin resistance. Others appear to directly impair pancreatic beta cell function. A study published in the Journal of Applied Physiology found that patients on second-generation antipsychotic medications had insulin sensitivity that was 32% lower than matched controls not taking these drugs, independent of weight changes. That means even without gaining a single pound, these medications were making the body significantly worse at using insulin. For older adults taking these medications for sleep or anxiety, there are often safer alternatives with less metabolic impact. Cognitive behavioral therapy for insomnia has been shown to outperform sleeping medications in long-term outcomes. Certain non-pharmacological approaches to anxiety have strong evidence bases. This is worth a detailed conversation with your prescribing physician. I want to be clear. I am not suggesting anyone abruptly stop psychiatric medications. That can be dangerous. But I am saying that if you are taking one of these medications and your blood sugar control has deteriorated, the medication may be a significant factor, and your doctors need to know that is something you want to investigate. If what I am sharing today is opening your eyes to connections you never knew existed, please take a moment right now to hit that like button and subscribe to this channel. My mission is to give adults over 60 the information they need to have real conversations with their doctors. Share this with someone you care about. A simple click can spark a conversation that genuinely changes someone's health. Number 2. Fluoroquinolone antibiotics. The common infection treatment with a dangerous glucose secret. Ciprofloxacin, levofloxacin. These are among the most frequently prescribed antibiotics for urinary tract infections, respiratory infections, and skin infections, all conditions that become more common after 60. They are considered broad-spectrum, powerful, and effective, and they carry a warning that most patients are never given. Fluoroquinolones can cause severe and unpredictable blood sugar swings in both directions, both dangerously high and dangerously low. The mechanism involves direct effects on pancreatic beta cells. These antibiotics can stimulate the pancreas to release large amounts of insulin suddenly, causing a rapid drop in blood sugar. They can then interfere with insulin production, causing blood sugar to rebound dramatically high. The swing can happen within hours. The FDA issued a safety communication specifically about this risk, warning that fluoroquinolone antibiotics can cause hypoglycemia and hyperglycemia, with severe cases leading to coma. For seniors already on diabetes medications, the risk is compounded significantly. I remember James, a 78-year-old retired firefighter from Chicago. He had been managing his type 2 diabetes reasonably well for years. His doctor prescribed levofloxacin for a respiratory infection, a common, seemingly routine decision. 2 days into the course, James experienced a severe hypoglycemic episode at home. His blood sugar dropped to 41. He became confused, fell, and his daughter found him on the kitchen floor, unable to stand. He was lucky. He got emergency care quickly, but it should never have come to that. The interaction between his diabetes medications and the fluoroquinolone was documented. It was predictable, and nobody warned him. If you are ever prescribed ciprofloxacin or levofloxacin, and you are on diabetes medications, you need to monitor your blood sugar more closely than usual during the entire course of treatment. You should discuss with your doctor whether an alternative antibiotic class is appropriate for your infection. And you should have fast-acting glucose available in case of a hypoglycemic emergency. James told me afterward, with the quiet dignity of a man who had faced real danger, "Doctor, I had no idea a simple antibiotic could do that. I thought the hard part of diabetes was the food. I never imagined my prescriptions could be the problem." He was right, and now you know too. Now I want to hear from you. Have you ever experienced an unexpected change in your blood sugar after starting a new medication? Not related to diet or exercise, just a sudden shift after a prescription. Share your experience in the comments below. I read every single one, and your story may help someone else recognize what is happening to them. And now we arrive at number 1, the most damaging, most common, and most overlooked medication-related pattern affecting seniors with diabetes. And this one is not about a single drug. It is about something that happens when multiple medications combine in a way that creates a perfect storm for blood sugar chaos. Number 1. Polypharmacy and the additive glucose disruption that nobody is tracking. Polypharmacy is the medical term for taking multiple medications simultaneously, typically defined as 5 or more. And according to research published in the New England Journal of Medicine, more than 40% of adults over 65 in the United States take 5 or more prescription medications daily. Nearly 20% take 10 or more. Here is the critical problem. Every drug in isolation may have been studied and approved, but the combination of multiple drugs interacting with each other, with your aging physiology, with your specific gut microbiome, and with your nutritional status, creates effects that have never been studied in clinical trials. Because the trials are done on younger, healthier populations, taking 1 or 2 drugs at a time, not on 74-year-olds taking 11. The glucose disruption from polypharmacy is additive and multiplicative. You may have a statin raising your fasting glucose slightly, a thiazide diuretic depleting your magnesium, a beta blocker masking low blood sugar symptoms, a corticosteroid for your arthritis, spiking your glucose on flare days, an antidepressant reducing insulin sensitivity, a fluoroquinolone antibiotic prescribed for an infection, disrupting everything further. Each one alone might be manageable. Together, they create a system in which your blood sugar is being attacked from 5 directions simultaneously, and your diabetes medication is fighting an impossible battle. A landmark study published in the Journal of the American Medical Association found that patients with type 2 diabetes who were on 6 or more medications had blood sugar control that was statistically significantly worse than matched patients on 3 or fewer medications, even after controlling for disease severity, diet, and exercise habits. The drugs themselves were a major factor in the poor outcomes. And here is what makes this the most dangerous item on this list. Nobody is looking at the whole picture. Your cardiologist manages your heart medications. Your endocrinologist manages your diabetes. Your rheumatologist manages your arthritis treatment. Your psychiatrist manages your sleep medication. And nobody is sitting in a room looking at all 11 of those prescriptions together and asking, what is this combination doing to this person's blood sugar? I remember Dorothy, a 79-year-old retired nurse from Boston. This detail always strikes me. She was a nurse for 40 years. She understood medications better than most patients ever will, and even she had not recognized what was happening to her. Dorothy came to my office with an A1C of 9.8. She had been hospitalized twice in the previous year for blood sugar crises. She was on 12 medications. When we sat down together and went through every single one, we identified 4 that had known glucose-raising effects, 2 that depleted magnesium, and 1 that was masking her hypoglycemia symptoms. Her diabetes medication had been increased 3 times in the past 18 months in response to her worsening numbers. But nobody had stepped back to ask whether the other medications were the problem. We worked with her entire care team, which took persistence and multiple phone calls, to do a comprehensive medication review. Over the next 6 months, 4 medications were either replaced with safer alternatives or eliminated entirely. Her magnesium was supplemented. Her beta blocker was switched to a newer, selective version with less glucose impact. 8 months later, Dorothy's A1C was 7.1. She had not changed her diet significantly. She had not started a dramatic exercise program. The primary change was removing the medications that were quietly working against her. She told me something I will never forget. She said, "Doctor, I spent 40 years giving patients these medications. I never once thought to look at them the way you just did. I thought more was better. I thought every prescription was solving a problem. I never understood that together they could become the problem. Dorothy's story is not rare. It is the norm. And it is why I am asking you right now to do something that could genuinely change your health trajectory. Here is my action plan for you. Starting this week, make a complete list of every medication you take, including over-the-counter drugs, supplements, and anything prescribed by any specialist. Write down the name, the dose, and the condition it is treating. Then, request a medication review appointment specifically, not your regular checkup. A dedicated appointment where the sole purpose is reviewing your complete medication list with your doctor. If your doctor does not have time for this, ask for a referral to a clinical pharmacist. Many hospital systems now offer this service specifically for seniors on multiple medications. During that appointment, ask these specific questions. Are any of my medications known to raise blood sugar or worsen insulin resistance? Am I on the lowest effective dose of each medication? Are there any medications on this list that could be safely reduced or eliminated given my current health status? Are there any interactions between my medications that could be affecting my glucose control? Within the first 2 weeks of completing a genuine medication review, many of my patients report noticing changes in how they feel, improvements in energy, in sleep, in blood sugar stability that they had not experienced in years. Not because of a new drug, because we finally stopped letting the old ones work against each other. Within a month, many see measurable improvements in fasting glucose. Within 3 months, the A1C results often tell a story that surprises even their other physicians. Common mistakes to avoid. Do not stop any medication on your own without medical supervision. Some medications, particularly cardiac medications and corticosteroids, require careful tapering. The goal is not to be medication-free. The goal is to be on only the medications that are genuinely helping you, at doses that are appropriate for your age and kidney function, with someone tracking the combined effect on your blood sugar. Do not assume that because your doctor prescribed it, it cannot be hurting your glucose. Prescribers are human. They are busy. They are often operating with incomplete information. Your job is to be an active participant in your own care. That is not disrespectful. That is responsible. And do not underestimate how much your nutritional status interacts with your medications. Magnesium, vitamin D, and zinc all play significant roles in insulin signaling. Many seniors are deficient in all three. These deficiencies amplify the glucose-disrupting effects of many of the medications we discussed today. Ask your doctor to test these levels. They are simple blood tests. They are frequently overlooked. And addressing them can make a meaningful difference in how your body responds to both your disease and your treatment. So let's recap what we covered today. Number 7. Statins, which increase insulin resistance and may raise fasting glucose in older adults. Number 6. Corticosteroids, which can cause dramatic glucose spikes even on short-term courses. Number 5. Beta blockers, which can raise blood sugar and dangerously mask low blood sugar symptoms. Number 4. Thiazide diuretics, which deplete magnesium and create conditions for worsening insulin resistance. Number 3. Antipsychotics and certain antidepressants, which impair insulin sensitivity independent of weight changes. Number 2. Fluoroquinolone antibiotics, which cause unpredictable and potentially dangerous glucose swings. And number 1. Polypharmacy, the combined and untracked effect of multiple medications creating a glucose disruption that no single drug adjustment can fix. Each of these items can be addressed. None of them are a life sentence. But you cannot address what you do not know about. My main message today is not fear. It is not to distrust your doctor or stop your medications. My message is empowerment. You now have information that most people with type 2 diabetes never receive in a standard office visit. Use it to ask better questions. Advocate for a complete medication review. Understand that your prescriptions are not neutral. They interact with each other, with your aging body, and with your blood sugar in ways that matter enormously. Here is my challenge to you. This week, write down every medication you are taking, every single one, and bring that complete list to your next appointment. Ask your doctor specifically about glucose effects. Give yourself 30 days of more informed, more active engagement with your own care. Your blood sugar will thank you. Your independence will thank you. And honestly, your doctor may thank you too, because you are bringing them information they do not always have time to piece together on their own. Dorothy, the retired nurse from Boston, told me something during her last follow-up that stayed with me. She said, "I feel like I finally got my brain back. My blood sugar is stable. I wake up in the morning and I know what my body is doing. I spent a year feeling out of control. It turned out the control was there all along. I just needed someone to help me find it. That is what I want for you." If this video helped you see your situation differently, please hit that like button right now. Subscribe to this channel so you never miss the real, practical health information designed for adults over 60. And share this video with someone you love who is managing diabetes. You might give them the missing piece they have been searching for. And now, I want to hear from you. Which of these 7 items surprised you most? Was it the statins? The antibiotics? The polypharmacy effect? Tell me in the comments. Your response helps other viewers know they are not alone in this. Because remember, aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.